Thank you, Mr. Speaker. We are 6 months into one of the worst economic downturns in our history. Albertans are anxious about their jobs, investments, and opportunities, looking for leadership, clear, strong leadership on the economic woes that are hitting Albertans hard. In the last 2 months, we've seen 20,000 jobs lost. To the Premier, why hasn't the government acted decisively to support these people, getting them back to work as soon as possible?
The Honourable Premier.
Mr. Speaker, first of all, allow me to congratulate the newly elected leader of the official opposition. Mr. Speaker, I also wish to express feeling towards those that have lost their jobs in the province of Alberta, and that's why we've articulated a three-point plan to ensure that we move through very decisively during this difficult period. And part of that, of course, is tightening our belt during these economic times, looking at our spending. We will continue to invest in people and infrastructure and make sure that our economy is ready to bounce back when things improve. And most importantly, we will draw down on the emergency savings that we've set aside, especially for times like these.
Yeah.
Thank you, Mr. Speaker. Given that just last week the Premier announced tax credits for parts of the oil and gas sector, will he take immediate similar action with other struggling sectors in the province?
The Honourable Premier.
With respect to any tax credit announcements, there weren't any. I made a commitment at the very same speech the Honourable Leader was to work with the oil and gas industry. They're in a credit crunch. They cannot access capital, and that translates to significant job losses, not only in Calgary, not only in Edmonton, but every small community in this province, right down to the tire shop, down to the motel and the restaurant. And that's why we're working with the oil industry to make sure that we provide the right environment for them to move ahead and create jobs in Alberta.
The Honourable Leader.
Many thousands recently laid off, and the many thousands more who feel increasingly fearful and vulnerable need to see action today. They need certainty. When can they expect real action from this government?
The Honourable Premier.
Mr. Speaker, we've taken action. Part of the fact that we're the only jurisdiction that I know of in North America that actually has cash set aside for situations like this. So that's really good planning on our part. And secondly, we are committed, as I said before, to keep investing in people programs, retraining, making sure that we have the skills necessary as we come out of this recession to have the people in place to fill the many job vacancies that will be here. And in terms of specifics, other ministers can give all of the specifics with respect to the programs we have.
Second official opposition main question, the Honourable Leader of the official opposition.
Thank you, Mr. Speaker. At a point where this government needs to show confidence and sound, responsible leadership, the Ministry of Health and Wellness is projecting a $1.3 billion deficit. To the Premier, how can the Premier account for this to Albertans?
The Honourable Premier.
Mr. Speaker, as far as the counting of last year's expenses, that goes to the Public Accounts Committee and they'll review that. But I just want to clearly state to Albertans that we are committed to publicly funded health care in this province, and we're committed to the principles of the Canada Compact.
Well, Mr. Speaker, we're talking about sound fiscal management of our health system. It's very clear that there has been no plan or foresight in our health reforms. Does the Premier himself or the Minister take responsibility for this astonishing financial fiasco?
The Honourable Premier.
Mr. Speaker, the current budget in health is over $13 billion. That's about $36 million a day. And I've asked the Minister to work with our healthcare providers, the doctors, the nurses, the professionals to come together and put on the table opportunities to gain efficiencies, improve access, improve quality of care in this province. I think there's a lot of money. Let's make sure that we're getting the best value for the dollar that's there. We have to improve programs. We'll certainly do that. But overall, I'm looking to healthcare providers to join us because we're in this together and deliver a plan that will build those three objectives that I talked about.
The honourable leader.
Does the Premier believe he has the confidence of Albertans in relation to a related critical service Albertans have come to stake their lives upon? I'm referring to the restructuring plan for the ambulance system. How much is that going to cost?
The Honourable Premier.
Mr. Speaker, in working with municipalities, our health minister is working towards, of course, the government taking over these services, and he's working very hard into the specifics. The minister can answer that directly.
The Honourable Minister, supplement.
Well, Mr. Speaker, I think what we need to do is not look at the transfer of governance and funding for ambulance as a cost, but an improvement in efficiencies. And we have already budgeted. It's in the budget that was passed in this House last year, the allocation for the transfer of ambulance services. And as I say, I think we need to look at this as part of an efficiencies